lighting in here. Capture people's attention. All right. So, are we just doing Ask Me Anything right now?
Yeah.
Okay. Hey guys, Dr. Barrett here. We are going live. Let's see, let's get all the cameras lined up here. I'm in my second operating room. I just finished a labiaplasty in the other operating room, which is right next door, and it has the nice, beautiful window view. Let's tilt this down a little bit towards me a little bit. We'll get some better lighting. So, you guys, with this, you've been waiting for is an Ask Me Anything session. So we'll go about 15, 20 minutes. We'll kind of get through as many questions as we can. Let's start with love body coaching. How difficult is a second rhinoplasty with a graft? Love body coaching depends on many different things, but a secondary rhinoplasty is always much more tougher. It's probably about 5 times more tougher than a primary rhinoplasty, okay? Miss Betty Boop, 1992. Hi, I want to get my boobs done by you. I'm scared. How often do you need to redo them after getting done? That's a great question. So if you get implants, how often should you get them replaced? I typically recommend 10 years because there's a lot of, if someone want to grab me an implant really quick, watch this. He's gonna throw it. Boom! Instant implants. We have these they're floating all around the office and then they're like popping up on people's desks. They're like having babies. So anyway, so why every 10 years? Implants don't really rupture very much until about 10 years and that curve starts to go up. So, and the main reason is mechanical stress, right? Over and over and over, like your breathing movements, whatever kind of movements you got. But anyway, breathing movements will cause mechanical shear, especially if it's on a pinpoint part of the implant, okay? And so that normally holds up until about 10 years if you have that situation. And so you have the option of either getting an MRI to check for rupture, or just actually simply replacing them. An MRI is actually really expensive. It's time cost, and it takes time. You got to go in this little machine, so if you're claustrophobic. So I just recommend to swap them out at 10 years. It's a 45-minute procedure, not a big deal, and boom, you're ready to go. I kind of equate it to getting your tires exchanged on your car, right? They're meant for 50,000 miles. Can you drive on 60,000 miles? Yes, but at what point are you going to rupture your tires or rupture your implants? Okay, so question on the YouTube over there. Should you lose weight to have a tummy tuck? Alicia Walters, yes. I think it's a good idea to lose weight prior to a tummy tuck unless you're already at your goal weight. If you're not at your goal weight, try to get to your closest to your goal weight as possible. Now, I did a surgery last week. You guys all saw it, where she already lost 100 pounds and she had a lot of skin hanging over, okay? Could she lose more weight? Yes, she could. Would it be safer? Yes. But sometimes people can't lose any more weight and they just need some extra help. They need to get rid of the extra skin. For her, we took off that skin and it was about 30 pounds. So if you guys want to check that out, those of you on my TikTok, check out my Instagram Reels. You can see this massive weight loss, okay? So go to Dr. Daniel Barrett, Dr. Daniel Barrett. You can just cancel that. And check out my Reels. It was last week where we took off 30 pounds of skin. Okay, Graz, is breast asymmetry after reduction? I had a reduction 6 months ago, 3 cups. One breast is higher than the other. Can this be corrected? Yes, typically, breast reductions can be very unpredictable. And so if one comes out looking slightly bigger or smaller than the other, yes, it can always be touched up. I always tell people that. It can always, breast surgery, any kind of surgery is not precise. It's like if you get, a BMW and you go to they go to get it repaired, they have a service manual of exactly what to do to fix the problem. Everybody's body's healed differently. And so sometimes I'll take out more on one breast, but that ends up being the bigger breast. It's crazy. So we oftentimes will redo, not redo, but just touch up like a breast reduction or breast augmentation if we need to, if things aren't looking perfectly. But also have to remember that breasts are never perfectly symmetrical, and chasing that perfection will get you nowhere because it can't be achieved. So having a reasonable amount of symmetry is probably the best results that you're going to get. Here's from Tay Y9. Is getting a breast augmentation dual plane a faster recovery than under the muscle? Tay, it's about the same because you're still lifting majority of the muscle with a dual plane. The key is to make sure that you use numbing medicine prior to doing the surgery and do a lot of rapid recovery techniques like we do so that you don't have much pain. Like today's case that we did, we injected a long-acting pain medication into the muscle. She had a capsulectomy. It was called Exparol and lasts for 3 days. So she's not gonna have pain for 3 days. Okay, Canadian here, R. Belcourt. How long do I need to stay for recovery? Breast lift with fat transfer. Really, people don't need to stay here for recovery. A lot of times people like to stay to get the first layer of stitches out to check, make sure everything's fine, and that's generally about 5 days. After that, you can go home. And you come back to see me for another visit if you like, but you don't have to. So option, you can get to fly in, fly out the next day if you like for most surgeries. I would say with the exception of tummy tuck, you might want to give yourself a couple more days before you hop on an airplane or a mama makeover. Okay, Devin She 18, talk about tubular breasts. Can they be corrected and still look natural? So tubular breasts, you guys know what tubular breasts are. It's basically breasts that are growing, and instead of the skin kind of relaxing and expanding, it gets kind of hung up, inferior or laterally immediately. And there's a procedure called tubular breast correction that can actually kind of expand the bottom part of the breast so that they become more round and so forth. That's what we do. So yes, it can be corrected, but typically you need to put an implant behind it to keep that open. Brianna Marie, Dr. Barry, you did my breast augmentation yesterday. Thank you for your staff and your help. Okay, good to see. Good to hear from you, Bree. I'm glad you're doing well. I did try and call you, but I couldn't get in touch with you. So I'm glad to hear through my Instagram live that you're doing great. All right, so how long do I have to wait for exchange my implants? Bigger one, 615 to 800. So, you know, if you're already 600 cc's, you probably shouldn't go to 800 cc's, okay? I don't really recommend it, but if you are planning to get surgery, you know, I generally say wait three months between procedures, especially if you're trying to go bigger. I got a question about a C-section scars pinned down. Why? That's from Badetsi. So there's a lot of great gynecologists out there and obstetricians, and they are focused on getting the baby out with a C-section, right? And there's a lot of hormones that are going on in your body. There's a lot of things happening. When it comes to that closure, many times it's can be closed correctly or sometimes not closed correctly depending on the situation, if there's an emergency going on. And what can happen is if you don't have all the layers underneath the skin, so like let's say you don't close that fascia layer underneath, your skin will tack down to your abdominal wall, okay? And so that's why you can get that indentation in your C-section scar. But the good news is it's an easy fix, okay? We can cut it all out, redo it, and bring all those layers back together so you get a nice, smooth result, okay? When I flex my chest, my right implant creates a dent in the middle and goes away when I relax. Justice 8989. So what you're experiencing most likely, I haven't seen you, is called a animation deformity. So if the implant's underneath the muscle and you flex your pec, you get a little squeeze down or you get a little movement. All right. The advantage, that's a con that comes with putting the implant partially underneath the muscle or totally underneath the muscle, is you get that animation deformity. But the good news is you can kind of control it. You don't always have to be flexing your pectoralis muscles, and you get that nice natural takeoff on the top, so that smooth teardrop shape on the top. So that's why I like the still going underneath the muscle, even though you can get that animation deformity. But most women don't have a problem with it. Just Chrissy, I'm 5 weeks post-op. Glad you're doing great. Great to hear from you. Is it bad if I do liposuction again? That's from Juna. Nope, it's not bad. I do liposuction again on people. Your yield goes down. Your first round of liposuction, you get a lot of fat, especially if you're trying to do a fat transfer. But the second round, sometimes you don't get as much. It could be a little more painful. I want to remove my implants. How likely will my chest go back to normal? Totally depends. So if you're going to remove implants and go back to au naturel, it's totally fine. We do it all the time. But if your implants are 600 cc's, you might have some extra skin. You might need a mastopexy. A lot of people will just take them out and they will let your breast heal and then come back and do a lift or do some fat transfer. I do a lot of implant removals and fat transfer, and that's a very popular procedure for people that don't want their implants anymore. Can you get your lips dissolved under anesthesia? Yes, you can, but typically it's not necessary. And I'm gonna wave to a bunch of people. What's up? And then we're gonna answer some other questions here. I lost some on YouTube over here. I don't know if we have a record of those. Yeah, here we go. This is for YouTube. Okay, so this is from Brittany. Turco glue. What happens if you lose weight after a tummy tuck? Will your skin be loose again? So last week I saw a patient. She had a tummy tuck back by me like 2019, and then she had a baby in 2020. Okay, and I thought it was all going to be stretched out, but guess what? It wasn't stretched out. So number one, you can have a baby after tummy tuck, and as long as you don't gain too much weight, and then sometimes after losing, like if you lose more weight after a tummy tuck, you may not need to have that skin removed. It just depends on how your body retracts and heals. Okay. So a couple more here from YouTube. Linda Navarro, tummy tuck and BBL, you recommend stage 1, 2, and 3 fajas. So Linda, I'm not a huge believer of fajas or compression. Here's why. When done properly, yes, they help with swelling. When done improperly, they can create grooves in your abdomen or wherever you're having the compression if it's not done right. Furthermore, you can actually get skin necrosis if it's too tight, especially with the tummy tuck. So for that reason, I generally recommend light compression for 2 weeks, and I don't get overly involved with all the fajas. I know people want to do something to kind of help improve their result, but most of your result is determined by your surgeon and your surgery, okay? So, Jared D, what brand of implants do you recommend? I like Mentor and Sientra implants. Allergan's also good. Those are the 3 main companies that are here in the United States. They're all pretty much good. I like Mentor a little bit softer. I like Sientra, the rupture rate's a little bit lower. Carla Lockhart, if you're getting a breast reduction, would you need implants to make them look good? If so, could I do a mommy makeover and a BBL all-in-one surgery? Carla, yes and yes. So we often do mommy makeovers. We often do breast reductions with the mommy makeover, and sometimes you can put a small little implant on the top. Now, that's not always needed. Sometimes we could just take the fat that we do from the tummy tuck and the liposuction and transfer to the upper pole for the breast reduction, and it gives you the same result. Just depends on your breast tissue and quality and laxity, but check with the plastic surgeon, come see me, or you can fill out a virtual consultation request on my website, you guys. So go to drdanielbarrett.com, go to patient resources, do virtual consultation, and you can fill out information, send some pictures, and I'll get back to you, and we can kind of come up with a better plan, okay? I have Sientra and love them. Everybody thinks they're real. Love body coaching. Yes, thank you. Can somebody with lupus get a mommy makeover and BBL? Yes. I have patients that have lupus and we've operated on them. We just got to make sure you're not going through an active flare and so forth. I actually had lupus antibodies myself. So if you have some kind of autoimmune condition, I'm going to go a little rabbit hole, you guys, so bear with me. If you have some kind of autoimmune condition, majority of autoimmunity comes from your gut. So you have to heal your gut. The number one way to do this is by fasting and healing your gut, giving your gut a chance to heal. Okay, I have a couple products I can actually show you guys that I recommend in my office, because when we do implants, that can also trigger immune reactions in people, right? So I do digestive enzymes. I do this product called Biome Breakthrough. And then I recommend fasting, not prior to surgery, not after surgery, but as a regular course when you're healed, okay? The reason why is because the more your gut is strong and doesn't have a leaky gut, yeah, we'll talk about this. There we go, I'm gonna take that one. So, all right, so this product's I recommend is Maximes. You can get that on my postoprecovery.com website, all right? I take 4 days with every meal. It decreases the immunogenicity of food particles, right? So that way, if a peanut protein gets into your bloodstream from your gut that's too big, it's less likely to cause an autoimmune reaction because this digestive enzymes already broke it down, okay? So that's step 1. Get digestive enzymes with every meal, okay? And then the other one is this product called Biome Breakthrough. Again, on my website, postoprecovery.com. I didn't make it, but I know the founder, Wade Lightheart, and this stuff changed my bowel habits. Like, I'm much better. It has IgA Max, which protects the gut, and also has probiotics and prebiotics, okay? But really the main thing that will change you completely is starting to fast, because that will decrease your body's production of crazy antibodies and all kinds of other crap. So I did a combination of those products, digestive enzymes, probiotic, the Biome Breakthrough, and I fasted for 5 days, and that was Christmas last year, and all of my lupus antibodies went away. So that's what I recommend, and especially after a lot of the research that I did, it all comes from our gut, guys. Digestive enzymes, Valea, no, you can take digestive enzymes completely normal, and I take digestive enzymes every single day. K-Tune 3000, how did you like the leaky gut powder? Let me know. And then, can you get a round 2 on BBL? Yes, you can. How long before eating should you take that? So the digestive enzymes you can take before or right after. Doesn't really matter. You can even take them when you're not eating, because there is some evidence that digestive enzymes will travel to different parts of your body and help lower inflammation. It's kind of crazy. So bone broth daily, yes. I love bone broth. I make my own bone broth. You guys, maybe I'll do a little thing about what I put in my bone broth. I make a batch of bone broth every week from leftover like bison bones. You guys want really good stuff, go to North Star Bison. That's where I get all my bison stuff, the majority of my bison stuff from. and you can get some good like bison bones for like bone broth and et cetera. Why I like bison? Because it's not factory farmed. There's no antibiotics. There's no growth hormones in it, and they're on pastures that are not treated with glyphosate. Okay, that's awful. Have you done any leg lengthening surgeries? Did you know this was a thing? Face Planet Chicago. I have not done any leg lengthening procedures. I've repaired a lot of legs back in the day, and I don't recommend doing any leg lengthening procedures. But Love Body Coaching. I plan on getting breasts redone by you in the future. I saw you helped bring girls closer together. I have large cleavage gap and want this fixed. You know it. Okay. To bring breasts closer together, it is possible. There's a lot of things you do with that. Okay. Just totally depends on the situation. But you can tighten the lateral side of the breast. You can release a little bit immediately, and you can also bring the breasts a little bit bigger. Can you reduce 38F to a B cup? Addison buyers probably can't get to a B cup and have it look like a normal breast. Probably can get to a C cup. I tell people this on a breast reduction because a lot of people, they have really big breasts and they're like, I want them gone. I want them gone. Okay, if you want them completely gone, they're gonna look weird, okay? They're not gonna look like breasts. If you want them to look like breasts, you gotta have at least some tissue there for it all to look normal, okay? So typically, that's around a C cup is as small as I can go. Have I done a B cup? Yes, but it took me 2 operations to make it look normal. And most people don't want to do that. How long do you recommend to leave drains in after reconstruction? Does fluid color matter? Yeah, so drains are things we put in after a tummy tuck or breast surgery. Totally depends on your surgeon, so check with them. But typically, as it gets clearer, turns to yellow, it's a better sign to get them removed. And if it's less than 20 cc's, 20 cc's a day for 2 days in a row is when I pull the trigger on that. Let me check over on YouTube here. Got a couple more questions. YouTube's firing off, man. Where are you guys coming from? All right. Do you have to wear a sports bra 24/7? You know, here's a cool thing. I don't actually recommend my patients to wear any kind of bra after surgery. Okay, so no bra or loose-fitting sports bra for 2 weeks after, and then you can wear any kind of bra. So what I found is that the breasts heal faster when you're not constricting them and keeping them tight. Okay, there's a lot of controversy on that. Like, what the hell is Dr. Barrett doing? But it works, and I do enough breast surgery to know. But follow what your doctor recommends. I have 2 kids, and now I'm an A cup. Can I get a double D in one breast augmentation? Totally depends. Awaken, because if you've had a lot of skin laxity in your breasts, and you've had some breastfeeding, chances are we can get you on the bigger side. But why do you want to be a mom with D-size breasts? Just curious. All right. Do your ANA numbers go to a regular ratio? Half a dozen fishies? Yes. My ANA titer went back to normal. Every trace of all of my lupus went away. And then, would you recommend an extended tummy tuck? Hell yes. If you need it, why not? Okay. How do you know you have leaky gut? So if your bowel habits aren't great, if you eat some food that makes you feel like crap, if you do a food sensitivity test, here's another way, a really great way. Do a food sensitivity test. I recommend one from Everlywell, okay? You probably see the Instagram ads. It really works. I've been tracking it over like every 6 months I do another one. And it tells you what foods your body is sensitive to, okay? So it's an IgG reaction, which means it's getting into your bloodstream. So if you have food sensitivities, more than 1 or 2, it's because your gut is leaking, spilling all this stuff into your bloodstream, which is bad, right? Your gut needs to keep on, contain, and digest all the food. So if it's leaking into your bloodstream, your body's gonna develop antibodies to it. And if it develops antibodies to, let's say, peanut protein or wheat protein, that antibody can now all of a sudden attack your thyroid, can all of a sudden attack your blood cells, can all of a sudden, which is lupus, can attack your joints, which is rheumatoid arthritis, can attack your skin, which is psoriasis, which can attack your gut, which is ulcerative colitis, right? This is where it's all coming from. All the crap and toxins in our environment, and us eating, 30 meals in a day when our gut just can't handle it, okay? So, did that answer the question? I think, yeah, that's where leaky gut comes from. And by giving your gut a break, eating less food, being smarter with what you're eating, that's how you can improve leaky gut. But yes, that food sensitivity test is how you can tell, because when I first started, I had 20 foods I was sensitive to. 20. It's insane. Everything I was eating is making me feel like crap. So I had a reduction list. I took it all out of the diet, and I felt better from that. But I ultimately wanted to start eating these foods again, because it's like certain foods, it's like, you want to be able to eat these things. So as my gut healed, I was able to add those foods back in, and now I feel much better. And I got an Ironman in October. I ran 15 miles this morning as well. I'm feeling great. But I did an NAD shot. I did an NAD drip earlier this week. I'm going to do one later today, which has also been helping. because I think I might have had a little bit of long COVID. So that's another topic. All right, we'll do one more question from YouTube. If you do a tummy tuck, but have a stubborn roll above the belly button, do you recommend lipo first? If so, how long between the two surgeries? Well, ideally the tummy tuck kind of gets rid of that extra roll, but if not, you can actually do additional liposuction or skin tightening on that area. Especially I see this happening if you get a tummy tuck and then you lose some weight and then you get that little extra bulge above. Okay, does buttermilk help the digestive tract? Brenda, I'm not sure. I have to do some research on that. Starting cost of BBL of a perfectly healthy 28-year-old, not overweight. You know, I don't know my pricing very well, but I think you could probably get a BBL around lowest maybe 12,000, and depending on how much liposuction, you can go all the way up to like 25,000. Okay. I want to explant with a lift. Would a fat transfer fill up what was there? Just depends on how big your implant was. Okay, guys. Of 32, I don't want bigger breasts, just perky, nice ones. Or what do you recommend? Mastopexy alone or mastopexy implants? Talia, it just depends. How perky are your breasts now? How much good quality breast tissue you have? Almost always are going to look perkier with an implant. So it just depends on what your goals are in your current condition. But fill out a virtual consultation page. I'll try to get back to you. Is flap surgery on stage 4 wound on a coccyx a hard recovery? Absolutely. Tony, Marie Gonzo, that is one of the most challenging things because you got to keep the pressure off of it, okay? So especially if you are paraplegic, if you don't have feeling and sensation over the sacral area, that healing is, you've got to be very careful. There's a protocol at Rancho, let's see, at a specialized, there's specialized places that actually can handle that. But yes, it's a very challenging recovery. But if you have a chronic wound, then you have to take care of it. Are internal slings good? You know, I'm not a huge fan of internal slings. That's where we use mesh and things like that. I just think it's overly popularized by these companies that make these products that may or may not be effective. All right, we've got a couple more minutes, time for just a couple more questions. Is it true that during mammogram with implants, you have to manually move the implant off the side? Milan, no. So if your implant, so a lot of people ask me this, can I get a mammogram after implants? Yes. If the implant's underneath the muscle, it makes it easier, right? Because here's your muscle and here's your breast tissue. And whoop, there you go, it makes it easier. If you go above the muscle, implants make it harder. So that's another reason to get implants partially or fully underneath the muscle so that you can get mammograms easier. So that's a great question. All right, one more question, you guys. Let's see. Dr. Nomad app. I have to check that out. Dr. On Demand app. Dr. On Demand. Oh, I have to check that out. How do you handle a patient with low platelets? It's me. I would say that you want to try to get your platelets corrected, but sometimes we do a platelet transfusion prior to that. But typically in cosmetic surgery, we try to avoid that situation because there's just risks to that. 4 babies later, is it dangerous to get a mommy makeover when your stomach stretch marks? I've gotten so bad, the skin is so thin to the point I can see blue veins. Sarah Ann, no, that's very common. You know, there's still enough healthy tissue to get rid of that extra skin. I had a patient yesterday who lost over 100 pounds plus, and she had very thin skin. We did a tummy tuck on her. I think it was actually on our Instagram, and it totally worked out fine. Okay, guys, thank you for watching. We're gonna go live next week, okay? And just a reminder, you want some more detailed information, check out my YouTube, Dr. Barrett Plastic Surgery YouTube. It is filled with great videos, topics. You can see the video podcast that I have, the Natural Plastic Surgeon. So if you have questions about breast augmentation, if you have questions about tummy tuck procedure, it goes through all of those things. Any one of those videos goes through all the details that you need to know. You can also subscribe to my podcast where I kind of go into a lot of those details as well. And then if you're on my Instagram, check out my TikTok, Barrett Plastic Surgery. And if you're on my TikTok, check out my Instagram, Dr. Daniel Barrett, where I have live surgeries pretty much every single day, and we talk about interesting topics. I talk about what shoes to keep my feet comfy during the day when I stand up, all kinds of fun stuff like that, guys. All right, so thank you so much, and you guys have a wonderful day.